Hello everyone, my name is Trinity James and my capstone project is called Disability, Bringing Visibility to the Invisible. I'm sure many of you are thinking, what are invisible disabilities exactly? Invisible disability is a term used to identify any disability that a person may have that isn't readily apparent to the onlooker. When many people hear the term disabled, they think of someone who no longer has the function of their legs or a person who has lost a limb. But there are other types of disabilities that aren't readily perceived. Sensory disabilities like deafness, mental or emotional disabilities like agoraphobia, and intellectual disabilities like learning disorders. Even familiar medical conditions such as asthma and diabetes can be invisible disabilities if they are severe enough. Fibromyalgia comes from Latin and Greek words that translate literally into fiber and muscle pain. Fibromyalgia causes muscle pain and fatigue, as well as other symptoms that range from a feeling of stiffness in the morning and a tingling sensation in the hands and feet, to difficulty sleeping and thinking, and it can even cause painful menstruation. It is not known what causes fibromyalgia, but it is estimated that there were 5 million sufferers in the United States in 2005. According to the Centers for Disease Control, it affects far more women than men, and those suffering from fibromyalgia have a higher likelihood of having major depression. The CDC also states that they have a higher suicide rate than people of the same age and also a lower quality of life. Like fibromyalgia, no one quite knows what causes CFS-ME. There isn't a medical test that can determine if you have it, and treatments that are available only manage the symptoms, and the side effects of the medication can easily outweigh the benefits. The main symptom is, of course, chronic fatigue that isn't caused by an underlying disorder. Some of the other symptoms that are associated with CFS-ME are sleep that does not leave one feeling rested, issues with concentration, issues with vision including blurred vision and sensitivity to light, balance problems, chills, and gastrointestinal problems. Fibromyalgia and CFS-ME can also be comorbid, meaning that they occur in the same patient at the same time. According to the CFIDS Association of America, there are at least 1 million sufferers in the United States, but difficulties in diagnosis cause difficulty in determining prevalence. The National Alliance on Mental Illness, or NAMI, says that 25% of adults will suffer from a mental illness in any year, and 1 in 17 people lives with a serious mental illness like schizophrenia or major depressive disorder. Most mental illnesses are not always so serious that they are considered disabling, but they can easily become disabling, even for a short period of time, if the person decompensates due to a lack of access to mental health resources such as a therapist or medication. A few illnesses that are more frequently considered disabling are schizophrenia, agoraphobia, and obsessive-compulsive disorder. Learning disabilities are caused by differences in the brain that lead to difficulty acquiring, interpreting, saving, and otherwise interacting with information. Having a learning disability is a lifelong struggle. Learning disabilities is an umbrella term for disorders such as dysgraphia, which causes difficulty spelling and writing one's thoughts down, and dyscalculia, which involves difficulty learning math. The type of learning disability that most people are familiar with is dyslexia. Dyslexia involves an inability to correctly process language. Usually it involves reading, writing, and spelling, but it can also hinder speech in some people. The decision on whether or not to disclose a disability is a very complex issue. It is not as simple as looking at one possible outcome of disclosure or one possible outcome of keeping your disability invisible. There are many reasons that a person chooses to disclose or not, and you should never assume to know what reason or reasons they have. One thing that most individuals will consider when making this decision is who they will disclose their disability to. One might choose to only tell people who are very close, or they might choose to tell anyone and everyone as a means of claiming it as part of their identity. It's also important for most people to consider how others will react to finding out about an invisible disability. Most people, if given the chance to be seen as a normally functioning person, will choose to be seen that way. This is a concept known in sociology as passing, being seen positively by others as a thing that you are not. Unfortunately, passing can be a double-edged sword, and I will discuss this and issues of disclosure to employers later on. According to Linksum, people with invisible disabilities who pass as not disabled face the risk of being exposed and devalued. If a person chooses to pass and not disclose their disability to a family member or friend right away, they may get upset and feel that the person doesn't trust them enough. Co-workers and employers may accuse the person of malingering to get time off, sympathy, or lowered expectations as to what they should accomplish on the job. In addition to the examples already given, one can be met with reactions like people telling you that you aren't really disabled because you don't look ill. They may refuse to believe that there is anything wrong with you and that you're just lazy and unmotivated. There could also be accusations that you are a liar and can't be trusted. A person who suffers from neurological disabilities that affect balance and/or speech may be assumed to be drunk if they have difficulties in public. One woman who was interviewed by Sharon Dale Stone revealed that her husband did not believe that she had any impairments at all after her stroke, and used that and the fact that she didn't have a job because of said impairments in their divorce proceedings. Others expressed wishes that they did have physical disabilities because at least other people believed them then. Passing, particularly with an invisible disability, can be a complicated process. As outlined by Linksum, the motivation to pass instead of disclose can come from shame, the fear of stigmatization or exclusion, and other factors. The ability to pass allows certain freedoms that those with visible disabilities don't have. People with visible disabilities are often questioned about how and when they became disabled by strangers. Those that are passing avoid these efforts to pry into personal information. People with visible disabilities also frequently have their ability to perform a task called into question, something else that passing helps avoid. Passing involves self-monitoring to make sure you are presenting yourself in the correct way. Making realistic choices, like knowing the best times to grocery shop and not going out when you can't present yourself in the way you would like, and careful planning of daily work and socialization. One strategy that those who pass use is to focus all of their energy into passing at work. This allows them to perform work duties optimally, but they are forced to neglect socialization. The lack of socialization with coworkers may easily be written off as being so busy that they don't have the time. Unfortunately, this can lead to overexertion, and the person will have to compensate by resting more than they normally would, given their disability, if they hadn't put so much effort into appearing normal at work. Because of this, their family and romantic relationships suffer even more. Again, though, this can be brushed off by saying that one is too busy with work. The first thing a person with an invisible disability should know about employment is that you are protected from employer discrimination by the Americans with Disabilities Act, which I will cover in a later section. When considering disclosure to employers and coworkers, those interviewed said that they feared being under more and closer supervision, the possibility of being fired, and that they would be pressured to work harder than their coworkers in order to prove that they deserve to keep their job. Dalgan and Gilbride also found that it was preferable for many to find jobs that were accommodating to their disability and thus didn't require disclosure. There is a need for more programs that provide this matching service to those with invisible disabilities. Also needed are programs that teach people with invisible disabilities how to appropriately and effectively communicate their needs for accommodations and one that empowers them to ask for accommodations when they need them. It is also important that employees are aware of what rights they have, what accommodations they are entitled to, and how to report it when they are denied those rights and accommodations. The needs of students with disabilities often don't get the attention they need, due to school counselors lacking the training and experience that are necessary to work with such students. Even though the graduation rate among students with disabilities is on the rise, the percentage of those who go on to college is still only 27%, and most of those are not enrolling in 4-year schools, but vocational schools or 2-year schools. Hatch, Shelton, and Monk found that students with disabilities need more attention from school counselors than their peers, particularly when learning about and transitioning to post-secondary education. They are also less aware of their career and educational opportunities than their peers. Another area where counselors need to help students with disabilities is in self-advocacy. Most students don't know their rights and may not know that once they graduate from high school, the Individuals with Disabilities Education Act doesn't apply and they will need to ask for accommodations under the Americans with Disabilities Act. As with employees with disabilities, students also benefit from learning how to effectively ask for accommodations, how to explain their needs and disability, and being more knowledgeable about their rights. The Americans with Disabilities Act of 1990 prohibits discrimination by employers, state and local governments, labor unions, and employment agencies. Discrimination can be, among other things, not hiring a qualified applicant because of their disability, not advancing the career of a person with a disability because of their disability, firing an employee who develops or discloses a disability, paying a person with a disability less than their equally qualified coworkers, and not making reasonable accommodations for an employee with a disability. It's important to note that the ADA covers employers with 15 or more employees, so many small businesses are not required to abide by the laws set forth by the ADA. The ADA also covers discrimination by state and federally funded public and private universities, vocational colleges, and community colleges. If the school receives funds from the federal government, they are covered by the ADA or the Rehabilitation Act and must make their programs accessible to students who are qualified regardless of disability. Accommodations for students may include exam aids like calculators, exam accommodations like a longer test period, course materials that are available in an alternate format like audiobooks, and allowing work to be made up when a student misses a class due to their disability. As you can see, those with invisible disabilities face just as many struggles as those with visible disabilities, and their struggles are real. Some of the struggles are the same, such as asking for help or accommodations, but many are different. Those with visible disabilities are not forced to either prove their disability or to hide it, and are not accused of malingering. My sincere hope is that I have provided a brief glimpse of what it's like to have an invisible disability, and that maybe you'll think better before not believing someone if they choose to disclose their disability to you. Furthermore, I hope that if you have an invisible disability, you have learned that you are not alone and that you do have certain rights under the law.